Admission to hospital for treatment. Section 3 of the Mental Health Act 1983. Why am I in hospital? You are being kept in this hospital under Section 3 of the Mental Health Act 1983. This means that two doctors think that you have a mental disorder and you need to be in hospital so that you can be given treatment and care. How long will I be here? You can be kept here for up to 6 months at first so that you can be given the treatment you need. You must not leave during this time unless the person in charge of your care, your responsible clinician, tells you that you may. If you try to leave, the staff can stop you, and if you do leave, you can be brought back. What happens next? Your responsible clinician will tell you when they think you are well enough to leave hospital. If your responsible clinician thinks that you need to stay in hospital for longer than 6 months, they can renew how long you can be kept in hospital for up to another 6 months, and then for up to a year at a time. Your responsible clinician will talk to you about this towards the end of each period. What treatment will I be given? Your responsible clinician and other members of staff will talk to you about any treatment they think you need. In most cases, you will have to accept their advice. After 3 months, there are special rules about any medicine or drugs you are being given for your mental disorder. If you do not want the medicine or drugs, or are too ill to say whether you want them, a doctor who is not from this hospital will visit you. This independent doctor will talk to you and the staff at the hospital who know you. The independent doctor will decide what medicine and drugs you can be given. Unless it isn't an emergency, these are the only medicine and drugs you can be given without your agreement. This independent doctor is called a SOAD, Second Opinion Appointed Doctor, and is appointed by an independent commission which monitors how the Mental Health Act is used. There are different rules for some special treatments, like electroconvulsive therapy, ECT. If the staff think you need one of these special treatments, the rules will be explained to you and you will be given another leaflet. Can I appeal? Yes, you can appeal against a decision to keep you in hospital under Section 3. To do this, you can ask the hospital managers to let you leave. You can do this at any time. The hospital managers are a special committee of people set up within the hospital to decide whether people should be kept in hospital. They may want to talk to you before deciding whether to let you leave, or you can ask a member of staff to help you contact the hospital managers. Your nearest relative can also write to the hospital managers to say that they want you to be allowed to leave hospital. This leaflet explains further down who your nearest relative is. If your nearest relative does this, the hospital managers must let you leave within 72 hours, unless your responsible clinician tells them that you might be a danger to yourself or other people if you are allowed to leave. If this happens, it will be another 6 months before your nearest relative will be able to tell the hospital managers again that they want you to leave, if you are still being kept in hospital then. You could also ask a tribunal to say you should no longer be kept in hospital. What is a tribunal and what happens? The tribunal is an independent panel which can decide whether you should be allowed to leave the hospital. It will hold a meeting with you and with staff from the hospital who know you. This meeting is called a hearing. You can ask someone else to come to the hearing to help you, if you want. Before the hearing, the members of the tribunal will read reports from the hospital about you and your care. One of the members of the tribunal will also come and talk to you. When can I apply to the tribunal? You can apply to the tribunal once at any time in the first 6 months that you are kept in hospital under Section 3. You may then apply once at any time during the second 6 months, and then once during every year that you are kept in hospital after that. If your nearest relative told the hospital managers that they wanted you to be allowed to leave hospital, but your responsible clinician said you were not allowed to leave, your nearest relative can also apply to the tribunal. Your nearest relative must do this within 28 days of being told that your responsible clinician did not think that you should be allowed to leave hospital. If you want to apply to the Tribunal, you can write to the Tribunal Service, P.O. Box 8793, 5th floor, Leicester, LE1 8BN. Telephone 0845 223 2022. You can ask a solicitor to write to the Tribunal for you and help you at the hearing. The hospital and the Law Society have a list of solicitors who specialise in this. You will not have to pay for help from a solicitor with this. It is free of charge under the Legal Aid Scheme. Letting your nearest relative know. A copy of this leaflet will be given to the person the Mental Health Act says is your nearest relative. There is a list of people in the Mental Health Act who are treated as your relatives. Normally, the person who comes highest in that list is your nearest relative. The hospital staff can give you a leaflet which explains this and what rights your nearest relative has in connection with your care and treatment. If you do not want this person to receive a copy of the leaflet, please tell your nurse or another member of staff. Changing your nearest relative. If you do not think that this person is suitable to be your nearest relative, you can apply to the county court for someone else to be treated as your nearest relative instead. The hospital staff can give you a leaflet that explains this. Your letters. All letters sent to you whilst you are in hospital will be given to you. You can send letters to anyone except someone who has said that they do not want to get letters from you, and letters to these people can be stopped by the hospital staff. Code of practice. There is a code of practice that gives advice to the staff in the hospital about the Mental Health Act and treating people for mental disorder. The staff have to consider what the code says when they take decisions about your care. You can ask to see a copy of the code if you want. How do I complain? If you want to complain about anything to do with your care and treatment in hospital, please speak to a member of staff. They may be able to sort the matter out, and they can also give you information about the hospital's complaints procedure, which you can use to try to sort out your complaint through what is called local resolution. They can also tell you about any other people who can help you make a complaint. If you do not feel that the hospital complaints procedure can help you, you can complain to an independent commission. The commission monitors how the Mental Health Act is used to make sure it is used correctly and that patients are cared for properly whilst they're in hospital. The hospital staff can give you a leaflet explaining how to contact the commission. Further help and information. If there is anything you do not understand about your care and treatment, a member of staff will try and help you. Please ask a member of staff to explain if there is anything in this leaflet you do not understand, or if you have other questions that this leaflet has not answered. Please ask if you would like another copy of this leaflet for someone else.